want to talk to you about a paper that I have torn apart. And it's a 2016 study titled Hyperinsulinemia Precedes Insulin Resistance in People with Obesity. Now, this study and its findings align with many of the teachings that Peter Attia actually speaks about on metabolic health. But it demonstrates, so this study demonstrates that elevated insulin levels often occur before the onset of insulin resistance, suggesting that hyperinsulinemia might be a primary driver of metabolic dysfunction, not merely just a symptom. So I want to actually just talk about that study for a bit, because I've torn it apart. I've researched it. I don't know if you know about it.
Yeah, I do. This is... In fact, I have published, you could have cited work from the Bikman lab that show a similar theme. Yeah. In fact, I very much, this is something I'd alluded to earlier. There are a handful of distinct causes of obesity. There are three in particular that I focus on as primary, and this is a nice opportunity to mention them. Stress is a primary cause of insulin resistance. The more a person has elevated levels of the stress hormones, epinephrine, also known as adrenaline, and cortisol, the more they're going to become insulin resistant very quickly, too. But it's quickly resolved as well. A second primary cause, independent of any of the other three, or the other two, stress and the last one, is inflammation. When inflammation is dialed up in the body becomes insulin resistant very quickly. This is something that someone wearing a CGM can actually see and even use to predict the onset of a cold or flu. That when an individual has an increased inflammatory milieu within the body, they become insulin resistant very quickly. This has been something that you can track with autoimmune diseases, as has been published in people with rheumatoid arthritis, that when the disease is active, as autoimmune diseases can ebb and flow, as if the disease is active, the insulin resistance is demonstrably increased. As the disease subsides for a time, so too does the insulin resistance. Those are the two of the three. And then the other one is the one I've already mentioned, which is insulin. As much as elevated insulin is a feature of insulin resistance, it is a cause, but we're talking about obesity. There can be no increase in human obesity without at least frequent and often chronic increases in insulin levels. Insulin is an absolute necessary signal that tells the fat cells to store energy. Part of my problem with a lot of people who say insulin doesn't matter, it's all just calories in, calories out, is that they're often too ignorant or unaware, or in some instances perhaps just low intelligence, just stupid, to appreciate the clinical study intervention. That they will say, look at this group of people, they were all overweight, and they were put on either a low carb or a low insulin or low fat diet, and they all lost the same amount of weight. But that's because you're asking the wrong question. We shouldn't be saying, if we deprive, so the problem here is this huge confounding variable of, you take the average individual who's this chubby, eating a standard American diet, and put them onto a low-fat diet, guess what? They're eating less of everything, carbs included. And so it's no surprise that in every single study that has ever measured the patient's fasting insulin, on even a low-fat diet, guess what happens to insulin levels? It goes down. So as much as you say we just reduced calories, but you also reduced the total carbs coming in both groups, certainly even the low-fat group, compared to what they were eating before, and thus it's no surprise. So the question needs to be, which diet is most resistant to fat gain? A hypercaloric low-carb diet or a hypercaloric low-fat diet? That study has never been done at the level of a randomized controlled trial. There has been one case study published and found just what you would expect, that they found that in this person eating the exact same number of calories, albeit differing in fats versus carbs, when the person was on a low-carb version of the high-fat diet, they gained nothing. When they were on the high-carb version of the high-calorie diet, they gained a lot. And so we should be asking this question through the lens of which diet makes you fatter. And if it spikes insulin, you're getting fat. And there is decades of studies to show, including famous metabolic scientists like George Cahill. George Cahill, one of the most famous fasting metabolism scientists that has ever lived, was once asked, what is the difference between lean and obese people? He thought about the answer and replied with all of his wisdom and experience, the obese person lives life at a constantly higher insulin level. And you see this again and again, whether it's fasted insulin or whether it is the insulin response to carbohydrate. A paper that I was just looking at published in 1996 in the journal Gut found that in obese and lean people, you give them the same amount of carbohydrate in the diet, and the insulin response goes up about twice as high and takes 2 to 3 hours longer to come back to zero, or to baseline rather. And this is why this is part of the problem. The more insulin is elevated, the more fat you're going to be storing, because that's what's telling the fat to store the energy.
So how does this then all tie into cardiovascular disease?
Oh, right. That is a good question. So there are myriad ways.
Just to finish up.
Yeah. Well, this is a doozy, but a relevant one, because as much as I painted the picture earlier that insulin resistance is the most common health disorder worldwide, the most common cause of death is heart disease. So heart disease is what most people with insulin resistance are dying from, and it's not a coincidence. It's directly causal. So just for the sake of time and clarity, I'll focus on one particular part of heart disease, namely hypertension. So high blood pressure is known to be the primary risk factor for heart disease. And most people would just think, well, I just have high blood pressure, not realizing that there is a strong metabolic component. There have been Dr. Gerald Reaven, another legendary metabolic scientist. He identified 5 distinct ways in which insulin resistance causes hypertension. And I won't mention all of them, but some of them include the inability of the blood vessels to dilate, as well as the blood vessels getting thicker and thicker and kind of growing in to themselves, narrowing the passage or the lumen of the blood vessel, making it be a much higher pressure. And with more pressure comes more damage to the blood vessel wall. But just to put this into perspective, if you have a patient who is taking an antihypertensive medication, so a medication to try to correct their blood pressure, and they adopt a low-carb diet, which is the fastest way to improve insulin resistance, usually their insulin resistance improves so quickly, which is seen by such a rapid improvement in their blood pressure, that within just days, and I'm talking 2 or 3 days, they often have to stop taking their blood pressure medications because their blood pressure is now going too low. That's how fast this happens. It's so quick that truly anyone listening, if you're on a blood pressure medication, you have to communicate with your physician's office, because you're going to have to start changing the dose almost immediately. That is how intimately causal insulin resistance is to high blood pressure. You remove the insulin resistance and all of a sudden the house of cards has tumbled.